Okay, well, I'm going to go ahead and get started. I want to be respectful of everyone's time, especially on a Friday. I hope everyone is well and is doing okay. I'm going to start with roll call real briefly just to make sure we have most of our committee members here. Angela Gamboa.
Here.
Harvey, please.
I'm here.
David Carnahan.
I'm here.
Thank you. Dr. Don Fowles. Elizabeth Paz.
Here.
Jasmine Snipes.
Here.
Harry Stevens.
Here.
Here.
Monica Curry.
Here.
Dr. Wilson. And Vista Thompson.
I'm here.
Thank you guys for taking the time out to come today. We have a very robust agenda, which I'm excited about. First thing we're going to do is go through the website. We've made some changes and I'm not going to walk through the entire website like I did before, like line by line. I want to highlight the changes that we made and the updates from the recommendations that everyone gave from the last meeting. And I don't know if Mary's going to pull up the... So there was an overwhelming desire and request for the FAQ section. So we started compiling that. Vesta, I've received some information from you today, and we're going to look at that, but I want everyone to, we'll start with that one because that's the newest tab. And have a look at some of the information we've put in FAQ. If you get a chance, there are about 18 to 20 FAQ questions that we've put in this section. I'm not going to go through them one by one. That would entail most of the meeting. But if you get a chance to look through this, I would definitely like to hear your feedback. If there's some additional questions, we tried to be very general to give an overview. There's so many specifics we could get into, and we don't want to go down a rabbit hole. But we want to be able to direct people to find the appropriate information that they need. Some of those are links to other sites and information and things like that. If you scroll down, Mary, a little bit, just to give them an idea of what some of the questions are, Pathetic, thank you. And so, again, this is a living, breathing document. Right now, we're going to make changes after we get a good foundation for the website. We'll do updates probably quarterly, and then down the road, maybe every 6 months. So, but I think there's a good start to the FAQs if you guys take some time to look at that, and feel free to email me with any other recommendations. That would be fantastic. Or if you have any, concerns about what's there now, let me know. We tried to be sensitive so it applies to consumers as well as insurers and providers. We tried to cover the whole spectrum of services. And so that's what we had. Any questions right now from just generally from what you see? We're kind of scrolling through it. Mary, can you go back to the landing page? The next section will go to Jake's Law. And so we modified this a little bit to update the proposed rules. So if you see on the right-hand side, there's a menu. If Press the proposed rules link. And there's the most updated information. We are open for public comment right now. If you want to make public comment, there's an email address there for that. There's a PDF, as you see, that has a readable version of the proposed rules. And we'll be updating this. There will be a WebEx for the public hearing. And so continue to check back. I will send out an email when the WebEx is available, so you will be abreast of when it's happening, how to log in, and things like that. But for general information about the proposed rules, it is right here. Any questions?
Dr. Hennigan,
Yes.
can you tell us when does the comment period close? Do you know?
The comment period, we wanted to close, and Mary Kaczynski's on the line, so if I misspeak, please let me know, the 14th. But if we need to extend it, we will. If the fire department needs to extend it, but we will 14 prior to the hearing.
Yeah, I also included a link to the actual notice in the Arizona Register in the chat. So if anyone wants to look at the actual
Yes, she did.
publication in the chat. We haven't received any public comments as of today.
For wanting to get comments in, there's still time. Any other questions? I know we're going to dive into the proposed rules as a topic later on in the agenda, but any comments or questions about the website part? Okay.
I think it looks well done. I think there's a lot of good information there, and I think it looks very well done.
Thank you. Mary, can you go back to the landing page? We'll go to the next updated section.
Just a quick comment that somebody said in the chat, the link did not appear in the public chat. I think Mary had said she was posting the link in the chat. That just popped up. I just wanted to make sure folks could get that.
This is Ruth Ann from DHS.
Yes?
I was wondering if there's some way, if somebody types in suicide into your search, that they would get to this, because the part that we have in our rules, referring to your rules, deals with people who have attempted suicide or have suicidal ideation. And if they're not going to know to look on your webpage for the mental health parity.
Okay. So adding some type of search component, so it would take them to the specific page they would need to go, like for resources?
Yes, to the page where they can find out about getting information about appealing an insurance determination.
Thank you for that.
So Lynette, this is Erin. I just typed suicide into our primary search bar on our website, and it did pull up the Jake's Law tab under our mental health web content, but I think we can certainly go back and look, and it may just be a matter of adding additional content on some of the other pages to make sure that the search feature finds that.
Yeah, we can narrow it down to be more specific, to be more directed to a certain area. So, putting that in my notes. Thank you. The next area we updated was the mental health resources. Now there are a tremendous amount of resources here in Arizona and Maricopa County. And so we could, if we did every single resource, it could just go on for days. So we try to synthesize and be very succinct about the resources that we have. So we started with, one time in crisis, and then we did a lot of external links to some resources that are already there. Instead of recreating the wheel, there's some people just may not be able to find it because there are so many. So we just directed them to specific external resources to help cut down on getting lost in the internet and on Google and things like that. So if you click on crisis hotlines, it goes to the access page where it lists the different, and it covers all the crises: suicide, COVID, veterans. And so it's very comprehensive, where they can look to see, what if I'm in crisis? Who do I call? Go back, Mary. The next one, there were a lot of comments in the chat, and thank you for those, about what if I'm being discharged too early and I don't feel like I'm ready to be discharged, or what if my family member is being discharged too early? Arizona Center for Disability Law has a great resource to kind of direct a patient on, I'm in the hospital, I need more time, how do I handle that? So if you click that patient resource about how do I navigate that while I'm still inpatient, it's a brochure that they can actually print out, or their family member can print out and take it with them if they're going to the staffing at the hospital. So we thought that this would be a very effective tool that they could use to help, step by step. What do I need? Dates, documenting everything. What did the doctor say? What medications am I on? So this is a brochure that is printable, that they can take with them, a family member, or if they have access to their phone, they can pull it up on their phone. Go back. The next one is about SMI services, or seriously mentally ill services, in our public health. What if I need that level of care? How do I navigate that? Where do I start? And so that directs them to the CPR website, which up here. And it kind of explains, how do I get an evaluation? Who can request it? What are the steps? And how do I get that? It talks about, even if you can't get there to the appointment, we're in the world of telehealth because of COVID. So it explains all those steps for a family member or a person that is seeking those type of services. And then go back. And the last one, where can I find counseling services? What if I have an addiction? What if I am in recovery? What if I need ongoing behavioral health services counseling? So the 211 website is masterful. It has already kind of detailed all those resources out. And scroll down a little bit more. And so they can see it's, it has mental health support groups, substance abuse disorders, and in those, it gives a list, a very expansive list of different counseling services where they can get help. And, we want, patients to know, which is explained, you want to always contact your insurance company or your insurer to see if those services are covered, who's contracted, and things like that. But 211, and they may usually, when people are looking for services, it's not just one service. There's usually overlap with, I need a food box, I need housing, I'm having issues, I'm not employed right now. So it's a one-stop landing page where they can get the specific one that they're looking for, but if they have some collateral or accessory services that they need, they can find those here too. And then go back. Any questions on the resource page or comments?
I think it looks really good. Very much appreciate your work.
I would
Yes,
certainly
please.
emulate that. I think it's, like I said, it's very well done. Looks very professional. Looks good.
And as resources change, we will, be astute to trying to make sure that we are giving the most current information as well.
I think it's really well done. I think there's a lot of good stuff in there. The one little question is, you can only do so much. You can't do everything. But I think one thing that comes up in the parity discussions, it has to do with pharmacy issues.
Okay.
And I don't know if there's anything embedded in the information that's provided there that would address that. Maybe under the last tab would be the most likely place. But it's just something to think about.
Pharmacy issues, as in what sense, Dr. Fox?
So, if someone's being asked to switch from one med to another as a part of a step therapy program, and they think, and they want to, they feel like they have an issue with that, and they want to either try to address it by one of the resources here, or help them figure out a way to file a complaint or something like that.
I wonder if, back on the main MHP page, if we look at the complaints and appeals section, if we have a topic there that relates specifically to, if we don't have a topic there that relates to prescription drug benefits, that might be a good place to add it, so that if somebody lands on this page and they have questions about whether it's step therapy or a medication denial, or Dr. Paus, do you think that this might be a good place to address?
That's a pretty good idea, really. I'm thinking, sometimes people run into medication issues, and if there's a place that provides some information, that either where they might get their question answered that way just by having some information available to them, or some of the providers that you've listed there have pharmacists and others who can help address questions. Just a simple phone call to one of them might help clarify the issue and get it resolved. It's something along those lines, because I know, like the one with CPR and the SMI is really, I think that's really good. I mean, it answers a lot of the questions there, and I think I do know that some of the providers that would be found under the behavioral health tab do have some good information on pharmacy, and also have some pharmacists and providers who are available to they do it all the time at address questions that patients may have.
Okay.
That's it's maybe getting a little too far afield or complicated, but it's something to be thinking about, because pharmacy is such a huge part of people's treatment for some populations.
It's definitely something we can look into and direct to the appropriate resource, and make sure they have the information they need to navigate that, because it can be
that's it.
Yeah.
We can look at our FAQs too to see if there's a one that might fit there as well.
That's a good idea.
Okay. Thank you.
Thank you. And then the final updated area is the glossary. So we did a very general, I guess, definition and glossary. We didn't want to get too far into the weeds, because it states this at the top, even though there's general definitions, the laws and different insurance companies and providers interpret definitions a little bit differently, but we wanted it to give enough so there's a general understanding of what something means. And so many of these definitions have been taken from the NAIC glossary. There's a link there. They have a very comprehensive list. But here's where we had to start the most requested ones from the chat and from the meeting last month. And so Mary, if you can kind of scroll down a little bit to give them an idea.
Hi, this is Ruth Ann. I was wondering if you could add appeal and complaint to your list.
As a glossary item?
As a glossary, because as someone who's not all that insurance savvy, until I looked at your list of what should be addressed under an appeal versus what should be addressed under a complaint, I use them interchangeably.
Okay.
Which they're not.
And I think the general public, if you're not in this world, you probably do use them interchangeably. Before I started working in the field, I did too, so I definitely understand that. Thank you. Any other comments or questions about the glossary? This is what we have. Everyone's input. I thank you. It's growing and it's continuing to evolve into something really useful. So again, if you have anything that you think of later that you want to add or comment or have questions about, feel free to email me for webpage updates. If there's not anything else on the webpage, we will move on to the next item. Okay. Next, we are going to have talk about the conflict of interest statements. I think some of you we've had an email about it, and I said last meeting that we were going to have an update this meeting. So, Dean, when you're ready, go ahead and take it away. The floor is yours.
Thank you. Good afternoon, everybody. My name is Dean Alzanoff. I'm the Regulatory Legal Affairs Officer here at the department. And yes, today I wanted to talk to you about the conflict of interest laws. These are just a set of laws that apply to you as committee members. I believe somebody might have talked to you already about the open meetings laws. This is just another set of laws that I guess we can call it restricts certain things, again, to committee members such as yourself. At some point after today's meetings, you will receive an actual conflict of interest form. You will have to complete that form. You will have to sign it, return it back to us. So this presentation is intended to sort of help you with that process, give you an overall introduction to the laws, obviously to help you with filling out those forms. Of course, you can always feel free to contact us about any questions about that. I will leave my contact information at the end and you will see that. Okay, so let's get into it. At the next slide, you will see the statutory standard. This is pretty much the statute that sets forth the actual conflict of interest, the main conflict of interest laws. The purpose of the statute is to pretty much remove or limit the possibility of personal influence which might bear upon an official's decision. So the thinking behind it is, right, public officials, they make decisions, they make recommendations, and the law is trying to avoid situations where the committee's members' professional or financial concerns and interests might conflict in their unbiased performance of their duties in any given board, such as this advisory committee. As most statutes, there's a lot of words here. I will focus on three main words, and you will see the next slides which those are. So let's start with the first one. At the next slide, you will see who does this law apply to? And I'm pretty sure most of you are thinking, how does this apply to me? I'm not a government employee, but it does. You are considered under the law a public officer. As you can see here, these are actually excerpts from current Attorney General opinions, also Arizona courts, which have confirmed that committee members are public officers under the law. Therefore, conflict of interest laws apply to you. Another thing is that you don't have to be compensated for you to be still considered a public officer. So yeah, so the law applies to you. You guys are public officers being part of this committee. The next slide, we will talk about the relatives aspects. Again, the conflict of interest law applies to you, but also to any relatives that you have that might have substantial interest in any decision, any advice that you give as part of this committee. So thankfully, the statute defines it, so we don't have to guess what relatives means. You can see here, these are the actual express definitions of what the law considers relative. So when you fill out the forms, when you're thinking if a relative has a substantial interest, look at this, look at the statute and decide if that's the case. And the next one is the next slide, you will see the pretty much the most important part here. Do I have a substantial interest? Because if you have a substantial interest, you have to disclose it, and then you have to refrain from participating in that matter. Right here, we have a very useful test from the Attorney General's handbook. Pretty much you have to ask yourself 3 questions. If the answer to all of these questions is yes, then yes, you do have a substantial interest. You will have to disclose it. You will have to refrain from participating, making a decision in any way in that specific matter. Sorry, one more. So as you can see here, the first question, it's a bit of a subjective test. But then when you get into the second and third, you will see that they're pretty specifically defined. An interest is not something of general interest. It's not your interest in what this committee does. An interest that you have to disclose is a pecuniary or proprietary interest. That's a much, much more specific and limiting way of looking at it. So now we would go to the next slide. We will see the definition again, pecuniary or proprietary. This is not a general interest in the subject matter. This is a ownership, a financial interest in something that, again, this committee works on, advises on. So anytime you see interest, don't think, do I have an interest in what, do I have a general interest, any sympathy, any feeling about this board, what this committee does? Well, again, that's not what the law is looking at. The law is looking at, do you have a financial interest? Do you have an ownership interest? So again, that's what triggers it. If you have a pecuniary or proprietary interest, and if you answered yes to the first question, and if you answered yes to the second question, now you move on to the last one. And the next one is the question about remote interests. So yeah, some interests are just remote. Again, the statute has made it easy, but actually defines 10 interests that are remote. That means by statute, these 10 listed here are removed from being substantial interests. These are just excerpts, so definitely urge you to read the actual statutes and to make sure that if these remote interests apply to you, because if they do, then yes, again, it will not be a substantial interest. You don't have to disclose it, and you don't have to refrain from voting on it. So that's, again, the test is 3 yeses and you're out. Let's go to the next test, which pretty much, I'm sorry, to the next slide. Again, if you answer yes to all these questions, and if you do have a substantial interest, all you have to do is, again, recuse yourself from that specific matter. Again, you're not being kicked out of the board of the committee. You are still participating in it. You just cannot participate in that specific matter, in that discussion, or the final decision that is being made on that matter. Just again, the conflict of interest law do come with possibility of civil and criminal penalties if you don't follow them. So just wanted to give you a heads up. Of course, we don't ever see that happening. People follow the law. But that's pretty much it. Again, substantial interests are just sort of trying to protect the ultimate decision, ultimate product that this committee will turn out, make sure that it's unbiased by any personal, financial, ownership, property interests. The final slide, you will see my just my information. Feel free to reach out. Obviously, I personally cannot give you personal advice, individual legal advice on each matter, but I would be absolutely happy to help you and kind of walk through the law, maybe walk through some scenarios and hypotheticals to maybe help you if you're having issues with filling out the forms. And that's all I have for today. I don't know if you have questions, or again, we can take it outside of this presentation and you can reach out to me. Thank you.
Any questions for Dean? Okay.
Thank you, Dean.
Yes, thank you, Dean. I will be sending you the forms, and I will also include some of the slides as well, just in case you want to reference back as you're filling out your form. If you have questions, and if you are confused as you're filling out your form or have questions before you sign it, again, you can email Dean and he can answer questions, but can't give legal advice. No questions, comments, conflict of interest? All right. Moving on, very excited, we have Jacqueline Kurth from Arizona Department of Health Services. And part of Jake's Law, or SB 1523, is that we have the suicide mortality review. And she is here to talk about that, give an update on that, which is the advisory committee is designed to give some advisory to that program as well. So Jacqueline, if you're ready.
Yeah, thank you.
Awesome. You're
Yes,
welcome.
I
Thank
am.
you for joining us. I appreciate
Sure.
you coming today.
Yeah, happy Friday, everyone. My name is Jackie Kurth. I am the Office Chief of the Injury and Violence Prevention in the Bureau of Chronic Disease and Health Promotions at the Arizona Department of Health Services. Next slide. Okay, so I have been invited here today to talk a little bit about the requirements under Jake's Law for ADHS to establish a suicide mortality review team. So everyone, of course, on this committee understands that back in March of 2020, Governor Ducey signed SB 1253, Jake's Law. Next slide, please. The two statutes that will impact the program that we are establishing at ADHS for the suicide mortality review are ARS 36199, the Suicide Mortality Review Team, Members, Duties, Review Team Termination, and ARS 36199.01, Access to Information Confidentiality Violation Classification. Next slide, please. Okay, so under 36199, the Suicide Mortality Review Team, this statute is lays out the foundation for establishing the Suicide Mortality Review Team at the Department of Health Services. This statute outlines the persons who will serve on the committee or the team. And this, I will tell you, is very similar to ARS 36198, which is the Drug Overdose Fatality Review Team statute. And this particular statute related to the Suicide Mortality Review Team is very similar to our Drug Overdose Fatality Review Team. So this is very nice because we have the infrastructure in our office. We do house the statewide Drug Overdose Fatality Review Team. So this will be following along with the same very similar structure. So this particular statute lays out the people who will serve on the team. This also lays out what we are to do on this team. So I think I have that on the next slide, please. So it's always really nice as a program to have very clear statutory guidelines to follow. So this statute also establishes what we are to accomplish on the Suicide Mortality Review Team. So we will develop a suicide mortalities data collection tool. We have already started that. I have a CDC epidemiologist that works on our Drug Overdose Fatality Review Team and has established a data collection system, statewide system for that program, and we'll be also developing a data collection system for the Suicide Mortality Review for the state. We will be responsible for conducting an annual analysis on the incidences and causes of suicide in the state during the preceding fiscal year. So this year we will be pulling the 2020 death data from the death certificates or the vital records and from the medical examiner offices, who we have a very close working relationship because of the drug overdose reviews that we do. This team will also encourage, our office at ADHS will also encourage and assist in the development of local suicide mortality review teams. Again, we have established policies, guidelines, manuals, and training for all of the county health departments for the drug overdose fatality review teams. We will be doing the same thing for the suicide review teams. Many of the rural county health departments, they wear hats and have less staff and resources. So, and there's a lot of overlap with the drug overdose team. So I believe if the rural county health departments will probably have the same team members that they do the drug overdose reviews doing the suicide mortality reviews. We will also develop standards and protocols for these local suicide mortality review teams and provide training and technical assistance to these teams. We will develop protocols for suicide investigations, including protocols for law enforcement agencies, prosecutors, medical examiners, healthcare facilities, and social service agencies. Study the adequacy of statutes, ordinances, rules, training, and services to determine what changes are needed to decrease the incidence of preventable suicides. So what we do typically is prepare case narratives, and the team will review those case narratives. We typically receive medical records and other records from other agencies such as DCS and law enforcement, and create timelines and determine what prevention measures or intervention measures could be provided, have been provided to the decedents and avoided a preventable death. And then we typically, in our annual analysis, look at all the data we've collected throughout the year and the prevention measures that were recommended, and make recommendations for the governor's office and the legislators. We will educate public regarding incidences and causes of suicides, as well as the public's role in preventing these deaths. Designate a member of the review team to serve as a chairperson. On our drug overdose team, we have a medical doctor who is able to look up the controlled substances through the Board of Pharmacy, and hopefully we will be able to establish a medical doctor as the chairperson for the suicide review team. And then again, this goes into the laws around review team members are not eligible to receive compensation, but members appointed pursuant to subsection B of this section are eligible for reimbursement of expenses pursuant to Title 38, Chapter 4, Article 2. The Department of Health Services, our Office of Injury and Violence Prevention, will provide the professional and administrative support to the team, and the review team established by this section ends on July 1, 2028. Next slide, please. Okay, so this, I'm not going to read this in detail, but this is statute 36-199.01. Access to information and confidentiality. So under, again, with our drug overdose team, we have pretty much the exact same statute, but it applies to the drug overdose. So we have our team members sign confidentiality agreements. We remind them that they are to destroy or shred the case narratives that are prepared for each decedent case that we review. And this statute will be very helpful, just as with our drug overdose. It allows us to request records regarding these cases that we review. So we have established a pretty good system of receiving medical records from the different hospital systems in Arizona, and again through the Department of Child Safety and from law enforcement agencies and behavioral health agencies. We receive information from Access, and so it's wonderful when you have statutory authority to support the need to get access to these medical records. So they really do help. Getting all these records really helps create the picture of the person and give you insight into what was going on into their life, and points of access where intervention could have been provided, such as emergency department visits and so on. Next slide, please. Okay, so the Suicide Mortality Review Program, as we talked about earlier, this was authorized in March 2020 when Governor Ducey signed Senate Bill 1523. We will be using Proposition 207 funding to start and maintain the program. We are allocating $675,000 per year for establishing the local teams. And we are targeting new funding to begin July 1 of this summer, 2021. Next slide, please. So we used a similar formula to determine funding for the different county health departments, similar to what we've done with our drug overdose program. And so, you know, suicides with less than 10 suicides per year will receive $5,000. 11 to 30 suicides, such as Apache, Gila, and Navajo, will receive $25,000 a year. Those counties with suicides in the numbers of 31 to 200 will receive $50,000, and that is Cochise, Coconino, Mojave, Pinal, Yavapai, and Yuma. And Pima County has between 201 and 500 suicides. So we've established $100,000 for Pima County's suicide review team. They will also review Graham and Greenlee, which is what they do with the drug overdoses. And then Maricopa County, with greater than 500 suicides, will have $200,000 to fund that program. And I included some slides for you here. This just gives you some information regarding the rate of suicide mortality in Arizona and the U.S. increased slightly from 2015 to 2019. And you can see on the right side of this slide is the age-adjusted suicide mortality rate per 100,000. So again, Yavapai, Gila, La Paz actually had the highest suicide mortality rates when adjusted per rate of population. Next slide. And this slide came out kind of messed up. I don't know why when it transitioned over to you guys, but this slide is the risk factors for suicidal ideation and attempts. The largest predictor of a completed suicide is a prior suicide attempt. So in the figure shown here, you can see the broader burden of suicidal behaviors, ideation, and attempts. Limitation is that we only have data on prior suicides attempts for adults for the year 2019. Previously, this information was not collected in the survey. So this is kind of interesting information, but we will be collecting a lot of data, demographic data, and be able to provide an annual report that has really good, a wealth of information to help us with our prevention measures. Having this kind of data and collecting this data through the suicide review will allow us to provide data-driven prevention measures to Access, who provides the suicide prevention program. Next slide. And then this is just an overview of the number of suicides broken out by county. So you can see some of the counties experienced increase in 2020. I can tell you that our drug overdose deaths have really significantly increased in 2020. It was not a good year. I think that was related to some of the social isolation, anxiety, depression, stress. And then we have seen a large increase in the illicit counterfeit fentanyl pills that are just everywhere in Arizona. So there are some crossover. We are pulling some of the drug overdose deaths cases that appear to be possibly a suicide. We'll pull those out and review those under the suicide mortality review team. But as you can see, the lion's share of the suicides is Maricopa County and Pima, of course, because of the higher population. But sadly, some of the smaller counties or rural counties have a fairly high number of suicides based on their size. And that's it, I believe, for my presentation. Any questions or?
Thank you, that was very informational. Any questions for Jacqueline?
I think just one thing for me, first off, as a great presentation, very very informative and also disturbing. And I think one thing that you all may already be aware, but our governor actually has pretty huge interest in this and actually spoke during National Suicide Awareness Week back in the fall at Hamilton High about suicide. And, Kara Christ was there from ADHS and Jamie from Access. And, it's good to know that the person at the top considers it important, as do a lot of his agency leads. And I really appreciate your bringing this information to mind, because it's something that we really got to figure out how to deal with better as a community here.
Yes. Yes, well, hopefully the suicide review mortality team will be able to identify, trends and do a deep dive into these cases and hopefully come up with some good recommendations for the governor and the legislators and for the access prevention program.
And I think just one thing to add to that too is how do you take those findings and trends and work with the people in the community to produce change, particularly with the providers who are providing care and others. What can everyone do differently that we're not doing right now?
Yeah, and you see, and what we see is that there's a great variation amongst the counties. So as with our drug overdose, we've been setting up and establishing local community overdose review teams, which I suspect will probably be the same folks that are reviewing the suicides in those rural counties. But, they make recommendations specific to their communities. And like I said, every community is slightly different. So I think it'll be helpful for the local counties to be able to evaluate what's going on in their communities and make recommendations that are specific to their areas. Yeah.
Jackie, when you're looking, kind of dissecting and analyzing the information, especially like looking at 2020, are you going to, I guess, compare or overlay how previously the resources, they may have had infrastructure for resources, but I'm thinking of some of the rural areas, once COVID hit, some of the infrastructure kind of the bottom fell out of that. Will they be looking at that to kind of say, okay, this was specific, these suicides were specifically COVID related versus just maybe what generally happens?
Yeah, so when we get information, we look at the records and we try to determine, and I think some of the local counties will probably, if the families are receptive, do some probably interviews of families, but to determine what impact COVID has had. And currently with our drug overdose, we're looking at those 2020 cases and pulling some of the cases aside. We're definitely pulling the cases aside that where a person has tested positive for COVID. Yeah, we will be looking at that and seeing the impact that COVID has had on the fatalities, the suicides, for sure. And, you know, one silver lining that happened as a result of COVID, we found, was the use of telehealth services. So, you know, we saw a huge spike in our overdose deaths in March and April last year, kind of when services were just halted and treatment was halted and, you know, support groups were halted. And so once people were able kind of to refigure out how they're going to provide services using telehealth, you know, that has been a good thing, particularly in some of these rural areas. So people can be connected for follow-up services and care. So yeah, it'll be interesting.
I have a question. If I'm remembering right, Jake's Law also called for the appointment of another sort of advisory committee within DHS. Is that the work of this committee, or have you created that committee?
No, I have not. I'm going to be responsible for the suicide review team, but I'm not aware of another committee being, well, let me take that back. Part of our Arizona health plan, AZ-HIP, has a component of the suicide prevention. So Carla Berg is heading that up at ADHS. So there is a group working that's focused on suicide prevention.
Any other questions or comments for Jacqueline?
There was a comment in the chat about, I think it was a question for Jacqueline about if maybe what are you seeing regarding youth in 2020? I presume that was related to suicide, if there was anything specific to youth suicide as opposed to adult suicide.
You know, well, we haven't seen, we haven't really looked at the cases. Unfortunately, we've seen an increase in those cases. So, and again, we've seen an increase with the illicit fentanyl. I know Yavapai County just had, I want to say like 9 youth overdose and die as a result of this illicit fentanyl. So we're not, you know, we haven't done a deep dive on the suicides yet, but so unfortunately, 2020 has had a really negative impact on all of our numbers. And you know, the mental health particularly, it's been a very difficult time for a lot of people. So they've turned to substances or, you know, or worse, suicide.
Thank you.
Mm-hmm.
Thank you. It will be definitely interesting to see the trends for that, especially with the kids being in and out of school. I know nationally that the suicide rate has gone up for youth and the attempts have gone up. And
Right.
we see that, like you said, the illicit, but you know, even alcohol sales have gone up like 220% in 2020. And so drilling down to see how that impacts and how we can impact that will be interesting to see down the road, so we can make some positive changes. Because
Yes.
You know, it's here. It's something that we have to deal with. COVID is something we have to deal with, and it's going to be a trickling effect to kind of iron those negative effects out.
Yes. Yeah. Yeah. Well, we'll make that, you know, that report will be published once we complete the first annual analysis, and that will be posted on our website and provided to the governor's office. Thank you.
Thank you, Jacqueline. This particular PowerPoint, can we share that for the information
Yes.
for the committee and things? Okay, awesome.
Sure. Yes.
Thank you so much.
Thank you all. Okay.
I'm sorry, Lynette, I just noticed a couple of other comments in the chat, in a different segment of the chat that I hadn't noticed before, called Q&A. It's from Dr. Wilson. Do we include psychological autopsies as part of the investigations into suicides in order to rule out accidental deaths? That was a very specific question.
Yes, so we're looking at best practices and looking at questionnaires that are used in Colorado. Actually has a really good questionnaire that is used for that purpose. So we will be putting together a questionnaire that's used to create our case narrative as well. And that, you know, as I mentioned before, collecting the information has been really helpful and insightful to getting just creating a background on the person, the decedent, and having an understanding of what led to their suicide.
And one other question, now I can't seem to get back to that Q&A section there.
I have it up. Having, let's see, do we require a suicide letter in order to label a death a suicide?
Do we do what? I'm sorry, I couldn't understand you.
So in order to label a death a suicide, does it require a letter, like a suicide note?
Oh, leave behind note?
Mm-hmm.
No. So it'll be no.
So it's based off the medical examiner's determination.
Correct. Right.
And one more question, when do we expect the first SMRT report? That was in the chat too.
Okay, is that the annual analysis that we'll be completing? Yeah. That will probably be within a year from this summer, so 2022. Unless the team is really, unless we get through those cases, you know, sometimes it just depends on the number of cases we pull for the sampling out of the total suicides.
And that will be posted to your website? The report?
Yes, Dr. Chris, of course, reviews all of our reports and gives it her final approval. And then, yes, once that's done, it'll be posted on the website.
Thank you.
You're welcome. If you have any other questions, feel free to reach out to me.
Appreciate you being here, Jacqueline. Thank you so much.
Yes, I appreciate it.
No problem. Yeah, no problem.
Okay, next up, we will have Mary Kaczynski talk about the proposed rules filing and update on that and hearing. Mary, are you still there?
I am.
Sure.
Okay, so the proposed rules are filed in the Arizona Register or published in the Arizona Register on February 12th. It also opened the public comments period, and it published a email address that we will take the public comments into. It also notified the public of our hearing that we will be holding on the 15th of March from 10 a.m. to 2 p.m. And it also ends the public comment period the day before the hearing, but we have kind of knocked around the idea, depending on what our response level is with regard to people submitting public comments in the email address or the participation in the meeting, we may choose to extend that public comment period for a couple of days. So we haven't made that final decision yet. And then once we close the record, we will move on to the next step in the rulemaking process, which is to try to assimilate all the comments and respond to them, but to make whatever changes we need to make to the proposed rulemaking, with the caveat that if we end up having to make a lot of substantive changes to the rules, we will have to start kind of from square one again, unfortunately. But hopefully that's not the case, and ideal world, everybody goes, yoo-hoo, we love these rules. And we move forward and get a final rulemaking in place. Any questions?
No questions for Mary?
And I posted the link to there's a link on to the register, which is what was published in the Arizona Register. It's in the chat. We also, Lynette put up a readable version of the rules on the website, so that, and we did that because the rules have to be spaced at 1.5 spaces or double spaced, and sometimes with the exhibits, it's difficult to read them because of the spacing. So we put Lynette put a readable version up on the website so that, and the notice about, where public comments can be submitted. So that resource is also available for people.
And just a reminder, if you're going to participate in the public hearing, and Mary, you can correct me if I misspeak, it is for public comment. It's not for like ongoing discussion to debate the rules, but it's for public comment. Is that correct?
Yeah, it's the for people who don't want to submit a written comment through the public comments email, or they can also mail in public comments. But for people who want to just put a public comment on the record, at a hearing, then that's their facility for doing that. The department itself can put comments on the record, so there may be some questions that come up that the department can answer, but it's really not a discussion forum. So it's just a vehicle for an extra vehicle for taking public comments.
And Mary, we have a question in the chat about the process for registering to testify.
We will put the instructions for that in the agenda when we post the agenda.
That agenda I'll also post that on the Mental Health Parity website.
Right, yes.
As well.
Yeah.
Any other questions or comments from Mary about the proposed rule?
If I may, Mary, we're anticipating setting up, I know you're going to provide written explanation, but I think there is going to be a process for signing up. And that's what we'll for signing up to be able to make a verbal comment at the public hearing. We'd like to, if possible, we'd like to have an idea of how many people are going to be making public comments so that we can manage the time well, but obviously it's a public forum, so people will be able to comment even if they don't sign up, but there will be a process for signing up. Is that right, Mary?
Yeah.
Okay, thank you.
Any other questions or comments for Mary? Okay, moving on. Very excited that we have Odette and Ruth Ann from Arizona Department of Health Services to discuss the posting of their proposed rules. I don't know who wants to take the floor, Odette or Ruth Ann, and speak to those at all. If anyone has any questions about those.
Hi, this is Ruth Ann. We were just going to answer any questions that may arise. Our rules, unlike yours, that are regular rules, ours are exempt rules. So we don't have to go through GERC, yay. And what we were required to do is post draft proposed rules for comment for at least 60 days. Those were posted the middle of December with a comment period ending on the 21st of February. So we would still accept any comments on them, but we have gotten some comments which we have looked at and have made some slight changes to the draft rules on the basis of those comments. Our plan is to try to draft a notice of exempt rulemaking and file that with the Secretary of State with an effective date, a delayed effective date of April 1st to allow the department and affected healthcare institutions to better implement the rule changes.
Ruth Ann?
Yes?
Question. I had somebody who had given me some comments and they didn't do it until just, actually it was this weekend. And I thought it was too late. So if I turn those around to you this weekend, they're very minor. Can I just send them to you directly?
Oh, sure. We did not want to do any more with the draft beyond addressing the comments that we had received so far until after this meeting. So please send them my way and we can discuss them and see how they can be accommodated.
Great, thank you.
Just if anyone in the committee has not had a chance to look at these rules, they speak to, I know there was a lot of discussion in our initial meeting about discharge planning, case management, and things like that. A lot of these draft rules speak to the discharge planning and things like that. So if you have a comment, go read it. These rules are not as in-depth and dense as the proposed rules from Jake's Law. And so if you want to get a comment in, which I'm understanding within there's still time, please take a look at these. It's on the Arizona Department of Health website. And I send it to the committee. If you guys would like me to resend that out to you, I can. But I don't know if there's any other questions for Ruth Ann or Odette.
Maybe we could put a link to the rule in the chat for folks in case anybody hasn't looked at it and they want to see it. That might be a quick way for, I was just looking for them, but I'm not sure which, maybe the suicide prevention
I'll see if I can do that.
Yes, that's it, Erin.
Is that it?
Uh-huh.
The suicide prevention?
Yep.
Requirements for inpatient exempt? Okay.
Yep.
I got it. I'll put
Great.
I'll put it in the chat.
Great, thank you.
You're welcome. There it is, everybody. Technology.
Wonderful when it works. Any other questions about those rules at this time? I appreciate Ruth Ann and Odette taking the time to come out, participate, and answer questions for us. Questions, comments? Maybe they'll come later.
Well, I wonder, Lynette, if when the rules are finalized, I don't know if there are any committee members that would like to have somebody from DHS come back and give an overview of some of the key elements. If that's, I'm just throwing that out there. I don't know that it's necessary for this audience, but if the DHS folks would like that, you know, we can certainly put that on the agenda if folks are interested.
There is a question in the chat. How was the ratio of 3-to-1 in 20-6-1506 determined?
What is it?
That's our rule.
Oh, okay.
Okay.
that didn't, you got me scared for a second.
I would
Mary Krasinski. Are you still there?
Yeah, this is Mary Krasinski. I'd have to defer to Mary Boatwright on that because she did a lot of those, the exhibits. I did not draft those, so I'd have to defer to her on that.
I don't, Mary, are you able to speak on this in this venue under these circumstances? I don't know if she is.
Yeah, I think she can.
Yeah, I can, Erin. I don't know what more you would like to say about the 3-to-1 ratio.
I think what I don't know how much we can say at this point. But what I would say is if anybody wants to submit a comment regarding the rule and regarding the ratios, regarding a different ratio, they should feel free to do so, and the basis for proposing different ratios.
I think something else comes in the chat because it came in the chat. Any other questions or comments about either one of the rules? Okay. Next, we'll move on. Topics for the next meeting. I'm very excited that Dr. Tim Clement is going to present at the next meeting in March on the new federal regulations that have come out and do a presentation. Any other topics of interest? Obviously, the rules will be an ongoing topic. Certain things will be ongoing. Any other topics of discussion that anyone wants to have on the agenda for the next upcoming meetings? No? Okay. Before I move on to the scheduling of the meetings for the rest of the year, I want to thank Deputy Director Evan Daniels and Deputy Director John Saveri for attending the meeting today. And I will go to Aaron to introduce John. He's new. We started on the same day, actually. But I think he's new to our forum. And so Aaron, go ahead and take it away.
Yeah, I just to acknowledge the participation from the director. Director Daniels is with us, and John Savory, our new insurance deputy director, is here. I'm not sure, John might have actually been here in time to participate in our last advisory committee meeting, but I don't know that he got introduced. So I just wanted to acknowledge their participation and commitment to the implementation of Jake's Law in the Department of Insurance and Financial Institutions. I don't know, John, I don't want to put you on the spot, but if you want to say hello or say a word or two, you're welcome to, but don't feel obligated.
Well, thank you for introducing me, Aaron. I was able to participate in the last meeting, so a lot of really good information and a lot of really good input, and I appreciate Dr. Hennigan leading the charge on this and your team putting together all that terrific information on the website.
Thank you. I don't know if Director Daniels has if he has a comment at this time or wants to give any input at this time.
Thank you. I'll just say I appreciate everybody's continued involvement and engagement here. This is, hopefully you've gotten the sense that as someone, I think Dr. Fowles noted earlier, this is something very important to the governor, and he's bringing a lot of resources to bear when you consider our department and DHS and Access, which, thank you to them for participating here today and their continued involvement. We really appreciate that and appreciate everybody's willingness to serve our state this way. We're looking forward to the results, and obviously this is not going to be something that we'll just figure it out really quickly. It'll be ongoing, but this is a really good step, and really glad to have this team together.
Thank you. And we have Dana Flannery on. Do you have any comments from Access for us? I know Director Schneider couldn't be with us today, but do you have anything? Comments?
Sure. Sure. Good afternoon, everyone. I'm Dana Flannery, and I'm the Senior Policy Advisor for Director Schneider. And suicide prevention is very near and dear to my heart, personally and professionally. So really appreciate the opportunity to be at the table. Thank you for all the good work you've done.
Thank you. Moving on, we have about 13 minutes left. I have proposed dates for the rest of the year. I know that as people get vaccinated and we move forward and we return to some type of normal lifestyle, fingers crossed, summertime is coming up. Hopefully we'll be able to travel and things like that. So I have the next 2 meetings as monthly meetings, and thereafter every other month. Any objections, concerns, questions? I'm staying with our current flow of Fridays at the lunchtime hour. Do these days look good for everyone? And I will send out invites and put them on the books if there are not any concerns or objections. Obviously, if we need a July meeting that something comes up, we have that flexibility where we can insert a July meeting and things like that. No objections? Awesome.
I don't have an objection, but I want to make sure my comment was seen before we adjourn. As far as what I'd be curious to learn about in the next meeting, I'm curious about the avenues and tactics being used to make sure that information is getting to at-risk populations, specifically Black, Indigenous, and people of color.
Just information on like the suicide, the website.
Yes, and the amazing resources that are being offered and the tools that are available for folks, because I'm recognizing and honoring that not everyone has the same level of access. So I'm just wondering how that's reaching certain populations.
Jasmine, I thank you for that input. We probably need to take a deeper dive into that to make sure that is getting to the populations that need it more. And if you have any recommendations on how we can do that, please let me know, because we want to definitely be inclusive and make sure it's getting to the right people.
I think you raise a really great question. Right now, we have just kind of static information that's available on our website. I think we've done a little bit through social media, but if anybody on the committee has any suggestions for ways that we can promote the information that we've developed here, please make suggestions to us. Yeah, I know I don't have a whole lot of experience with, I tend to do things very kind of, press release, a website, a brochure, but if there are ways that we could be promoting this information, and certainly this is public information, anybody on the committee and elsewhere is welcome to share this as widely as you want to, but feel free to give us ideas.
Absolutely. Thank you, Jasmine, for that input.
Yes.
Any other questions, comments, jokes, recipes for the good of the cause before we adjourn?
This is Ruth Ann Smagel from DHS again. If you would like, I can send to you the notification that we have filed the notice of exempt rulemaking, if that would be of interest to your group, as well as the fact that the filed version, even before publication, would be available on our webpage, which you now have the URL for.
That would be perfect. Yes, we would want that.
Great.
And I can also share that on our website too, and point back to yours. Thank you. Before we adjourn, I want to give kudos to, I don't think she's not on. Amanda O'Halloran is she's the IT magic behind the website. I'm just the information person, and she makes it look all beautiful and pretty. So I want to make sure I acknowledge her and all the hard work that she is doing. And she's just been amazing and is easy to work with and flexible. So I just want to make sure I do that while we are on and publicly give her kudos. Anything else before we adjourn?
If anyone has ideas for future agenda topics, please send an email to Dr. Hennigan or send an email to the MHPAC@difi.az.gov email address. We want to make sure that we keep the content of these meetings useful and engaging and helpful. So thank you.
Thank you. I hope everyone has a fantastic weekend. Stay well and safe, and we will see you next month.
All right. Thanks a lot. Appreciate it.
Thank you.
Thank you so much. Have a good weekend.
Thank
Bye-bye.
you.